Good morning, Mr. Wilson.
Good morning.
My name is Tyler Gatley. I'm the physical therapist that's going to be working with you today. I saw in your chart that you're 7 months post-diagnosis with ALS, and that you already kind of outlined some goals for us, which is fantastic. You specifically wanted to get back to a higher level of activity, and you wanted to reduce strength loss and preserve your endurance as much as possible. So today we're going to go through some activities, some exercises that are really going to target those goals for you. Going to be really relatable for you, I think, and they're going to help you achieve your specific goals. I also noticed that you're having some difficulty with your hands and some weakness in your hands. So we can work on some stuff adjacent to that, but for the most part, that treatment, we're going to recommend that you go see an occupational therapist as well. They're going to be a little bit better suited to help you specifically in that realm.
Okay. Yeah, all right. I have one question. So with my diagnosis, is there anything that you would recommend I don't do?
So really the biggest barrier that we're going to see as we go through our treatment is your endurance. So you probably will see yourself fatigued pretty quickly, and we're going to do some stuff to train that as well and help you reduce the fatigue that you're feeling, increase your endurance, and increase your strength. But we do want to focus on making sure you don't overwork yourself, either here in the clinic with us or once you go home and you're practicing at home. So really, yeah, just monitoring your fatigue is going to be the biggest thing.
Okay.
All right, Mr. Wilson, first exercise that we're going to be working on today, we're going to be targeting your gait. I noticed that you're dealing with some left foot drop. The muscles of your left shin are a little bit weak, and it's causing that foot to just fall as you're trying to swing during walking. And sometimes that's causing your toe to drag on the ground or to cause you to trip. So today we've got 9 cones set up over a 25-foot course, and we're going to walk down and back for a total of 3 times across the 9 cones. We're targeting your endurance here specifically, so that way as you walk about throughout the day, whether it's around your house or at work, then you're able to effectively keep your feet from tripping you up and avoid that foot drop as well. So a few things that we want you to focus on while we're participating in this one. We don't want you to be using your hip to hike up and try to get over the cone. We want you to specifically drive your knee up and forward, and we don't want you to let your foot drop down either. So as you're doing it, try to really focus on using those muscles on the front of your shin to draw your toes up towards your knee as you're trying to step over top of the cone. So those are the 2 big things. We also don't want you to like swing around the side of the cone. We are specifically trying to go right over top.
I guess you want me to use the mirror?
Yeah, so we've got the mirror down there as well, and that's going to allow you to watch the motion that you're doing. As you're walking down that direction, if you feel comfortable enough to look away from your feet specifically, you can look up into the mirror, and that's going to allow you to look at yourself straight on and get an idea of what your gait looks like. So that's going to help you avoid that sideways swinging thing, and it's going to help you keep from turning your feet any weird direction or allowing that toe to drop down as well. Alrighty, so I'm going to be right here with you. I'm going to be holding onto the gait belt. Using these cones, what we're going to do is we're going to have you start off with your right foot right next to the first cone. Good. And then you're going to step over using your left foot, and then take a big step with the right. There you go. Good. Good. There we go. Keep that toe up. Drive the knee forward. Perfect. Perfect. There we go. Careful not to swing sideways. Good. Very well done. Good. All right, we're going to come back, still using your left foot to go over top of the cones, and you're going to take pauses as you need it. I know that you might be feeling a little bit of fatigue. This one's a very tasking exercise, but let's get moving comfortably. Good. That's a better gait, not having to take as many steps in between. Pause there. Hold on. You feel okay?
Yeah, just a little tired. Not too bad.
Let's take a breather for just a second. Do you feel well balanced?
Yeah.
Okay, I'm just going to move this cone back into position. Very good. And whenever you're ready. Good. The second exercise that we've got for you today is some stair training. I know that you said you've got 4 stairs outside of your house to get in. You've got stairs to and from the basement, and then it's a 2-story home as well. So you've got plenty of stairs to navigate inside your house with a variety of handrail situations or lack thereof in terms of your outdoor stairs as well. So today we're going to be focusing again on that hip hike. We want to avoid the hip hike sideways thing, and we want to focus on driving your knee forward to lift your leg up and clear the step. It's also going to work on that foot drop that you're experiencing as well. We want to make sure that you think about bringing your toe high as well. Generally, the pattern that we're going to use is going to be an easy remember type of thing. It's up with the good, down with the bad. So in this case, your left foot is a little bit weaker. Not that it's a bad foot, but we do have to treat it that way. So you're going to, when you're ascending the stairs, when you're going up, you're going to step up with your right foot, and when you're going down the stairs, you're going to step down first with your left foot.
Okay.
I think for the purposes of your in-home training, since you've got both handrails on each side of the stairs, we can practice with your left hand on the rail. Just because you want the handrail, the sturdy segment, on the weaker side. You want as much support on that left side as possible for when you're stepping on it,
Okay.
both going up and down. But really, if you need the rails on both sides, you're welcome to use it.
Okay.
All right, so I'll be right here with you. I'm going to be on this left side as well. And whenever you're ready, go ahead and start on up with the good. Very good. Good. Focus on driving that knee real high and keeping your toes up. Good. Very good, just like that. Come with you here. Good. You said
Down with the right.
down with the left. So up with the good, down with the bad. Let that left one good, and then meet it with the right. Very good.
I'm a little fatigued right now.
Okay.
I don't know why.
To the floor. Go ahead and take a seat there for me. Very good. You feeling okay?
Yeah.
All right. A little bit short of breath. I can hear you kind of breathing heavy, so we're going to work on some breathing exercises that I've got for you as well. Is that gait belt too tight to prevent breathing, or is
No.
it okay? Okay. So the way that I want you to work on your breathing here is place one hand on your stomach and one hand on your chest, and I want you to think about when you breathe in, trying to push your belly hand out. So take a big deep breath and fill up your stomach as much as possible, and then as you breathe out, let that stomach draw back in again. Good. We're just going to practice that a few times. Give you a moment to rest.
Yeah, that's helping a lot.
Okay, good. We'll also have you use this in your home as well. If you're having difficulty with the stairs at home, make sure that you've got a chair close to your stairs so that way you can sit down as soon as you need it.
All right,
All right, Mr. Wilson, the next exercise that we're going to do is the balance kind of related to the basketball that you want to get back to playing. So I noticed that you mentioned you're having some difficulty with tripping and everything and just kind of coordinating your feet as you're going. So we're going to work on some balance using this AirX foam. Essentially, it just makes the ground really wobbly underneath you, and it makes you focus on really holding your balance well. So while I have you standing on that, I'm going to have you practicing catching. I'll be here guarding with you and giving you some tactile and verbal cues as well. And then I'll have our tech toss the ball to you. You can catch and toss it back to her. And that'll really work specifically towards your basketball goals. So the first way that we're going to do it, I'm going to have you stand on the foam. I'll demonstrate real quick. I'm going to have you stand on the foam, both feet just side by side. And then if that's a little too easy, then we'll change to what's called a tandem stance, where one foot is just in front of the other. And if that's still too easy, then we'll switch to a single leg stance.
Okay.
All right. Let me get that position for you. And then whenever you're ready, go ahead and step on up onto the foam. There you go. How's that left foot feeling?
A little wobbly, but not too bad.
Okay. So if you feel ready, go ahead and tell the tech that she can throw the ball to you. Ready? Good. We're going to do 2 sets of 15 of these.
Okay.
Unless you feel like this is a little too easy, then we can move it up.
It's pretty easy, honestly.
Okay, so pause right there. Then we're going to switch to that position where one foot is just in front of the other.
Does it matter which one's in front?
We're going to do actually both sides, so whichever side you want to start with. This one we call a tandem stance.
Okay.
There you go, very good. Nice. That's
Still
good.
pretty easy.
Good control, good control. You don't feel like that left foot is rocking to the side or anything?
No.
Okay, so then we're going to switch it up and we're going to do a single leg stance. Let's start on the right side for this one, just balancing on the right foot only.
Okay.
I'll still be here guarding with you. And then if you're feeling confident with the right foot, like you can do a few reps of this, then we'll switch to the left foot as well. Taking a little more focus, that's good.
Feel pretty wobbly.
Okay. You look steady. How you feel? You feel like you want to try out the left side?
Yeah, I'll try it. It's usually a little weaker,
Okay.
but yeah, I'll try it.
Let's give it a shot. I've got you here. You're not going anywhere.
Okay, I'll go ahead and try it.
Okay. Whoa. All right. Let's put that right foot back down.
Okay.
Maybe eventually we'll just work on some static standing on that left
Okay.
foot. But for right now, I think the tandem stance is going to be the best way for us to go. And we'll do 2 sets of 15 with the left foot in front and 2 sets of 15 with the right foot in front.
Okay.
Exercise that we're going to work on today, we're going to do a scap clock with a chin tuck. So it's a multifocal movement, and we're trying to train a few different things in doing this. We're trying to train the muscles of your upper back and the deep muscles inside your neck, and that's all going to help a lot with your posture, because as your ALS progresses, postural muscles are going to become very, very important to preserving your highest level of mobility and independence, and just retaining strength for as long as possible. So working on all of these muscles today and as early as possible is going to be absolutely key to success moving forward. So the scap clock with chin tuck exercise is one that focuses on 2 different areas at the same time. You're going to, as far as setup goes, kind of lean back against the wall. You want your feet out away from the wall just a little bit, so that way your lower back is pressed against the wall at the same time as your upper back. And your head is also, the back of your head is going to contact the wall as well. from this position, you're going to keep the back of your head in contact with the wall and tuck your chin down. It's going to make you sound a little bit funny if you're talking. It's going to probably give you a few extra chins, but that's okay. So you're going to tuck the chin first, and then while you're holding that chin tuck, you're going to retract your shoulders and imagine there's a clock that you're drawing the numbers of with your shoulders. So you've got your chin tucked, your shoulders retracted, and then bring them up and back down, and then straight back to the 3 o'clock position, and back to relax, and then retract and push them straight down to the 6 o'clock position.
Okay.
So it's 12 o'clock, 3 o'clock, and 6 o'clock, all while holding the chin tuck.
Okay.
All right.
That makes sense.
All right, let's see if we can go through that one. I'll be right here to provide guidance as well, in case it gets a little confusing.
Okay.
It is a difficult one to manage the first couple goes.
Okay. So for my chin tuck, it's like this.
It's just like that, yep. But make sure that back of your head doesn't come off the wall.
Okay.
Imagine there's a rod going through your ears, and you're just rotating your head around that rod.
Okay. I'll try that.
Good. And then squeeze your shoulders backwards and shrug them up for the first one. That's your 12 o'clock position. And relax. Squeeze shoulders backwards, and then all the way back to the wall. That's your 3 o'clock position. And then squeeze shoulders and depress them down towards the floor. That's your 6 o'clock position. Good. Whew. So this is a difficult one, and it takes a lot of focus. So we're going to go 3 sets of 8 on it. We're really targeting strengthening of all these muscles at the same time. But you let me know if you're feeling any fatigue or anything kicking in. We just want to really target strength. We're not trying to push endurance, and we don't want to burn you out too fast on this one.
Mm-hmm. Yeah, my head feels pretty heavy, but I know it's helping my muscles.
Okay. Alrighty, Mr. Wilson, the last exercise we're going to go through today is going to be some wall slides. And we're going to start off using a pillowcase to reduce the friction and make it a little easier. But if you're feeling strong with it, then we can move it up a couple of different ways, even maybe using a TheraBand to increase the resistance that you're dealing with. This one specifically is going to work towards that basketball playing as well. A lot of times in basketball, you're going to have your arms overhead, and you're going to have to keep them there for quite a while. And it also requires the strength, to bring your hands overhead for a shot or for a rebound. So this one's going to work on the endurance of your shoulder muscles and your serratus anterior muscles as well. And that's really going to help all of the muscles in your back and in your shoulders. So the first thing that we're going to start off with is using a pillowcase. We're going to have you kind of drape it over your forearms here, turn to the wall, and standing just about a foot away from the wall, you're going to want to slide your arms straight up and allow your body to move towards the wall, and think about actively using your muscles in your shoulders and in your back to push that pillowcase up the wall. So we'll do that one first. If that's too easy, then what we'll do is we'll have you take a step back this way, so that way you're having to actively hold the weight of your body as it leans into the wall, still then pushing up. And this one you're going to feel it a little bit more in your serratus down here under your arm. And then if that is still too easy, then we will introduce the green TheraBand for some resistance. You're going to actively push against it, and that's going to work more muscles in your shoulders, going to work the smaller ones in your rotator cuff as well. And as you're pushing out against the band, you're also going to slide your arms up the wall and control it and bring them back down again. All right, so you've got your own pillowcase there to work with. Very good.
You mind helping me?
Sure.
Thank you.
There you go.
Okay.
All right, so go ahead and take a little small step towards the wall. That way you're close to it. Very good.
It's okay.
That looks good right there. And since we're targeting endurance, we're going to go for 3 sets of 20 reps. But if it feels like, as you're doing this first set, if it feels like it's just way too easy, let me know, and we'll switch it up to the little bit more difficult progression. Good control, good control. Are you feeling those shoulder muscles working, controlling the motion?
Yeah, definitely.
Good, good.
It's pretty hard.
Pretty hard?
Yeah,
Okay.
it's like a burning pain, but not a bad pain. I can just feel my muscles working hard.
Alrighty. So then, to make it a little bit easier, let's have you take another small step towards the wall. The closer you are to the wall, the easier it's going to be. The further away you are, the more you're asking those muscles to turn on. How does that one feel?
Yeah, it's easier.
Okay.
You said 20?
3 sets of 20 reps.
Okay.
Yep.
Whew. Yeah.
Alrighty, Mr. Wilson. Good job today. Put in a lot of hard work. Those are the 5 exercises that we're going to use consistently throughout therapy. We're going to add some more. We're going to remove a couple, I'm sure, or we'll at least progress some of the ones that we're using. But those are a great baseline to use and measure your progress against. As you get stronger and as your disease progresses as well, we'll see changes in how those exercises go. And we now know kind of where you're starting from, strength and endurance-wise. So that's fantastic. You did really well today working on those. And I've got a home exercise sheet printed out for you that I'm going to send you home with. It's got 6 exercises on it, and I want you to do those exercises 2 times a day as they're described on the sheet. And along with the home exercises, if you start feeling that fatigue that you were feeling with some of the exercises we were doing today, remember to use those breathing techniques, the hand on the belly and the hand on the chest. Just really exaggerate that breathing and allow yourself time to calm down, because we don't want you to overexert yourself as you're doing them. Other than that, based on your current level of insurance authorization, we're going to see you 2 times a week for the next 4 weeks for physical therapy. Do you have any other questions for me?
I don't think so. Yeah, I really appreciate all your help today. Thank you, Ty.
Absolutely. Good job.